I'm here with Lily, Dr. Joaquim, and she did my veneers, and we're kind of going to talk about the steps and the process of getting veneers.
My dog's in the office, by the way. Emotional support animals are the first and most important steps of a big veneer case.
There's 3 appointments when you get veneers.
There's 3 to 4.
Right.
And I think for Hannah's case, so Hannah had beautiful enamel already. It was just a little mottled or a little yellow and white, which she didn't love. And funny enough, maybe 2 years ago, she had said, oh, I want veneers. I said, I'm not touching your teeth. Your enamel's really healthy. But I went to, a really high-level course this year where I learned I could do a minimal, no prep veneer and really give Hannah the smile of her dreams. And so once I came back from that, I was like, let's go. I was like, I'm ready. And so we did it, and her teeth turned out absolutely stunning. But first step were records, where we took a series of photos outside the mouth, inside the mouth, and took scans. I measured the plane of her face and where her teeth would sit to the horizon. Also checked her bite just to make sure that we were getting rid of any back interferences when she closed, so we could give her a healthy bite. That was the first appointment.
And didn't you take pictures to send to Gold Dust?
Oh yeah, I sent them everything. I sent pictures. I'll send you those photos.
Yeah.
And you can put them on the YouTube. She'll do the YouTube.
We'll do before and after.
Oh, this is actually Hannah's
these are them.
case. Yeah, I put it on here. This is Hannah's case. This is her finals. No, this is her finals.
Oh, wow.
Yeah. Gold Dust is really great. They are in Tempe, Arizona, top-notch aesthetic lab and functional lab, and I've been using them for my bigger cases, and I'm very pleased. So yeah, it was the first appointment.
Okay, and then second appointment was actually filing the teeth down.
I used a very specific template to make sure that I reduced enough in the correct places, made sure that her bite came together the way that the lab and I decided it would come together. And then I took the final impression both with a VPS material and a scan. And then I delivered Hannah a really beautiful set of temporaries on her top 10 teeth so that she would not ever go without teeth.
I'm surprised because they look like my real teeth. I don't know, I just expected them to be more chiclet looking, but these actually look like
I love that. You should definitely tell people
that.
Okay. And again, she stayed in that for a while. We had to bring her back for a second prep visit so I could reduce a little bit more in a couple areas so that we could still have a really nice thin veneer that wasn't bulked out. The porcelain needed to be thick enough, and I needed to reduce a little bit more. So that was the second and third appointment.
And then the fourth appointment, you got the individual teeth.
So I tried in each of her individual, we took off her mock-up, cut that off, tried in her veneers individually.
You can put the mouth condom back in if you need.
The mouth condom will go in shortly. I'm not quite ready for it yet.
All right.
Still working on your veneers over there. Just gotta get them nice and ready. Okay.
I mean, I think it's been working with them.
Yeah. And then the process of bonding the veneers is also very, very meticulous because I want this to be the cleanest, most intimate bond possible. So we clean and condition the porcelain before they are ever cemented, and we also clean and condition the teeth, and then we set each one individually, starting with the middle 2, moving back, and then we cure it with our curing light, clean any excess, and then we check the bite to make sure that everything feels good. We also scan Hannah for a night guard so that she can wear to protect her beautiful set of porcelain teeth. It looks so good. Okay, I want to have you look at your camera, do your thing. I got some photos of you. I'm super stoked. They look so good.
I was thinking of questions people might have about veneers. Is it painful? Yes.
Not painless.
Right. You have to she does shave your teeth off.
Okay, that's a little aggressive.
You don't lose all your teeth. I have half of the teeth that I had before.
Okay, I would say she has a little bit more than half. That's the mock-up. That's not your natural teeth. Let me explain that a little bit, because I've seen those viral TikToks of people's nubbed teeth where it's just circumferentially drilled off. We did not do that.
Right.
We took off the facial or the front part and a little bit on the incisal or the up and down part. The circumferential prep for her was unnecessary because she had healthy teeth. Sometimes we do have to do that on patients that don't have good teeth, but it kills me to see someone with really healthy teeth have a circumferential peg prep for a veneer. That's a full crown prep, which again, is sometimes necessary, but not often.
Yeah. And I was having like sensitivity issues with like heat and cold, but I started using Sensodyne, and that's like really calmed it down.
Oh, good. I didn't know about that. She doesn't tell me these things. Yeah, we also do Nutramax or ClinPro, which is a prescription grade toothpaste. We either have it here. I can give you a tube, by the way. It helps a lot.
Okay.
Or we can always write prescriptions for patients. But yeah, anytime we're doing anything to the teeth, these teeth are they are little organs essentially. They have their own nerve and blood supply, and so they're going to get irritated when we drill on them. And we put her through a lot, right? We drilled on it. We put temporary material. We took it off. We put it back on. We took it back off. We took it off again, and then we bonded something, and then that cement. It's kind of like, have you ever gotten your nails done and that light burns a little?
Yeah.
Same thing with your teeth.
Yeah, I get that.
Same thing. It just takes a little bit of time to heal.
Mm-hmm. What makes Gold Dust so much better than other veneer companies, and can like people go to their dentist and say, ask or request for Gold Dust?
That's a really good question. There are certain dentists that use Gold Dust, and they are dentists who have gone through what is called Clinical Mastery Series. So you're going to want to find a dentist who is trained in the Clinical Mastery Series. So to work with a lab like this, you have to really know your stuff, because they will just not make a veneer. Like if you walk into an office, someone just hacks at your teeth and sends off some impressions, they're not going to make you a set of veneers the way that Gold Dust does. It's very precise, calculated measurements and planning and communication that makes, you know, a set of veneers look like this.
And I sent you pictures of like celebrities whose teeth I liked. Didn't like the features of my face, you send that in and they kind of like formed it to fit my face?
Well, yeah, I mean, it's precise planning, and that's why some people have like a one-size-fits-all veneer, and it's like a chiclet, and it's too bulky and it's too opaque, or it just doesn't fit the face. So yeah, we take into account the face, the smile line, the proportions, and so yeah, you would need to find a clinical mastery trained dentist, and you would have to work with them and with Gold Dust to try to get the result that you want. And it's not easy to find those dentists. I've been practicing for 8 years, and it wasn't until 8 years out that I finally found a lab and a system that I feel like is reliable and reproducible, and I'm able to deliver a product that I like each and every time. Because I've struggled in the past not liking veneers that I've done for patients, or having to redo them, just not hitting the mark of what I needed. But now that I have the tools that CMS has taught me, I feel confident moving forward that I can deliver a beautiful smile. And
then what can people expect to pay for a set of veneers, or like can they get one tooth or two teeth done?
That's a really good question. For Hannah's, I mean, some veneers range in cost. When I first started, they were about $1,100 a tooth. A case like Hannah's, probably around $1,200 to $1,300 a tooth, because we do the diagnostic wax up, and then, you know, we're at a high level of porcelain. I would like to charge more, but my demographic really doesn't allow for that. I'm not in LA, I'm not in New York, where there's sometimes, and I don't want to charge this, but some are like $5,000 a tooth. Wow. But I would say that, you know, for a veneer here in Wichita, Kansas, with me, at least currently right now, it's probably $1,200 a tooth, maybe $1,300.
And what's the minimum amount of teeth you can get? What's the max?
So I like to do the top 10. Now, I have done 4, I've done 6, I've done 8, but 10 really gives you that really nice width and buckle corridor, like that expansion.
That full smile. But if you're not able to do something like that, you know, it really is a case-by-case basis. I don't like just doing a single unit, because that's really hard to match. Sometimes we can do the front 2, front 4. I've done the front 2 a few times, and that's usually fine. Again, and I worked with a different lab for those. It was Sunflower Dental Studio in Topeka, and they were still wonderful. But for these bigger cases where I'm really concerned about the occlusion and the function, I've just found that I'm able to communicate that with Gold Dust really well. Can you get all teeth?
I mean, like
bottom teeth too?
Yes, we can do bottoms as well, but usually I'll do it in phases. I'll do the top, keep the bottom in a mock-up, which I'm doing that on another patient right now. She's in a full upper-lower mock-up. We'll start the tops, make sure that's solid, and then we'll move into the bottom.
Wow.
Yeah, because again, we're looking for long-term function and predictability, and that just comes from testing it out really in the mouth before we do it.
Yeah, so the whole process takes like 3 to 4 months.
Because I feel like we started in February.
Did we? No, there's no way we started.
March?
Did we?
I don't remember. I'd have to look back.
I think it takes time, right? It's not just a done and done. At least that's how I want to practice when I do veneer preps and when I give a patient a new smile. There are some people who don't do it that way. You know, even in this office, people do it a different way and the patients are happy. They're fine. But this is just how I choose to practice because it's my conscience that has to live with it. And I want to make sure that I'm not doing something that I'm not going to love if I go to bed at night worried, you know.
And it's your name. It's your business.
100%.
Yeah. What would be a good candidate for veneers and what would be someone who wouldn't qualify?
It's a great question. You have to have really good oral hygiene. You can't have bleeding gums and you cannot have a mouthful of cavities because your veneers will fail. If you're a heavy grinder or if you've broken your teeth down, also not a good candidate for veneers.
Which I found out I grind my teeth because my temporaries were coming off because I was grinding them off at night. It would break, so that's why I got the retainer. And
she's not a heavy grinder. She did not destroy her enamel or I wouldn't have done veneers on her. But we're talking when patients used to have a nice big smile and they've broken their teeth down into nubs. That's more of like a full mouth reconstructive case that would need crowns. And again, a crown is like more of a full coverage. A veneer is like a partial coverage. But that's still a full mouth reconstructive case that we would take the same, very similar steps that we took with Hannah. It's just a different application of the porcelain and a different, you know, reverence towards the forces of the mouth. So those are things you're always wanting to take into consideration for long-term dentistry. And if you are a patient that wants a better smile but has a lot of cavities or has a lot of broken teeth, there are other options that we do. So veneers is more of a purely cosmetic, but even though I have a functional drive, but I did deliver a full set of dentures to a patient recently, and he told me he got to go on his first date a couple weeks after, and he was so happy. You know, we had to remove all the teeth in his mouth. He didn't have, you know, a good upbringing in terms of dental oral hygiene, but we removed all of his teeth. I placed some implants. I delivered him his dentures. He came in for his adjustments. He's been a phenomenal patient, and he was really excited. There's always a way to get your full smile back, even if it isn't veneers, whether it is a full denture, a partial denture, a few crowns. Fillings are also something we do. There's always a way. Every patient is just case by case.
Mm-hmm. I love it. I told her, I was like, I feel pretty, like my confidence is like...
She is pretty already.
Yeah, but I feel like I'm not worried about my teeth. Like, I had white spots on them and I was always self-conscious, and like the front two were just kind of crooked and...
Little snaggle. It was cute though.
Yeah, none of my friends are like, I didn't even notice it, but I noticed it, and so, you know, and I wanted it for myself.
That's what I want, is I want a subtle change, right? I don't want it to be going from like, you know, whatever your teeth are to like, here's these white opaque chiclets. I want it to be a natural, beautiful smile. It still has anatomy. There's still translucency. It's still respective to the patient's mouth. And that's what my goal is when I provide this type of treatment.
In the description, I'll put all of Lily's information below if you guys are interested in using her for services.
Yeah, come see me. I have people that do travel a little bit, but don't travel too far.
I also come here every 6 months for a cleaning.
She does. That's another thing that makes a patient a really good candidate, is someone who does have a good 6 month, you know, rapport with the office, because I can't do veneers if your gums are bleeding again or if there are a ton of cavities, because the dentistry will fail. Well, thank you, and thank you, Hannah, for trusting me with this process. It has been an absolute joy to give her the smile of her dreams.
Yeah.
Yeah, I'll see you in 6 months. Well, I'll see you later today. We're gonna go to the pool.
Yeah, we're going to the pool. Okay. Well, thank you.
Thank you, Hannah. Yes. Appreciate you, Knuckles.
Okay. Bye.
Bye, guys.